TV health talk show. We are focusing on every drop counts, breastfeeding with confidence. That is our theme as we celebrate this breastfeeding week. And I have with me in the studio midwife AKROFI, as she calls herself. She is Mary AKROFI, but we all like to call her midwife AKROFI. So you're welcome, Auntie Ness, Auntie Midwife.
Thank you, my lady. Thank you so much for having me this evening.
Thank you. Thank you for honoring our invitation to join us in our studio. It's a real privilege. I mean, we're discussing when to have this, and I was like, we need to do it this week. And she gave me the good news that we can do it today. Sure. So I'm really happy we didn't postpone, but having it today. And I believe so my viewers are going to enjoy and learn a lot today. Please pardon us for not starting early. We had to go for our baby from the from the labor ward. So right, please pardon. We have to prepare our baby. Very soon we'll introduce our baby to you. We have our baby here to help us with today's discussion on breastfeeding. So without wasting much time, we've heard about breastfeeding a lot. I mean, it's about women, but it's for everyone, as I mentioned earlier. And so thank you for joining us to help us understand this. Why is it important for us to for mothers to breastfeed? Why is breastfeeding important? Why should we take it serious that the whole world has to take this week to celebrate that?
Thank you so much for this question. Breastfeeding, I guess it's meant for breastfeeding, you know. It's important for you to breastfeed. In fact, this evening I'll mix the language a bit because I want my mothers in the house to learn more this evening, especially my Ghanaian mothers. If you say, when we talk about breast milk, it's nature's food. It is just there. Right after birth, it is ready for you to, you know, available for you to breastfeed your baby. And it's filled with nutrients. Breast milk is a vaccine. You know, during childbirth or after childbirth, we go in for vaccination, but those vaccines are specifically for some kind of conditions, are a protector in Quran. Do you get it? But when we talk about the breast milk, when the baby is out, you going closer to the baby, you know, their immune system is not well matured. All right, and don't see we say, oh, Fanima make a cry, no more so the hospital setting isn't conducive for that baby. Infections here and there. Until you taking the breast milk, especially the first milk, which is the colostrum, it is highly filled with nutrients, antibodies that will protect your baby against these forms of infections. And don't see a say oba say we choose breast milk. In fact, WHO, Ajiatu, the whole world say and one I recommended ama ye mamenom, ama abatine, semi paucho, ma wo bani nufon, ma wo banu nufun so esanse here. Ye nya nutrients wom, na ye nya antibodies wom, a building and system no, okay? Enzymes wom, insuo wom, just say imyani no ne doso. You can never compare it to any formula or nothing. Just say it is fully packed. And see, so we fear na make a say. No fun so nkwa ne here nuntina the whole 1 week of August ye see what say ye bo hu the ro so we fear ye catch so we ye juma so we ye then won't so be to me ama ubani nifo and together let us educate ourselves, okay? Na ye encourage you, tell your sister, tell your brother, obia making sure say or woni bana or ben man in so nature's gift, the very best gift every woman can give their babies is breast milk. Actually papa bia ni hobi. If you say yen pese ye man be yare na can say ya ko spending amounts binom e hospital. Into sweetheart, give your baby the breast milk because it is very important for them.
Okay, thank you. This has started well on a good note. The energy alone, I really love it.
Thank you so much, dear.
So, see, I say no function that we can't do without. Now, so I say I was say or train kakra, if you are all for so train kakra, so now I started breastfeeding. No cresa.
No creda. In fact, yen fanto yetrimu se enye nokre. It is advisable say within the first 1 hour you initiate breastfeeding. The first 1 hour. Obi beka say my CS me hon tell me and you know mean to me so baby ne mu debi. I'm at the recovery ward. After cesarean section, we care for our mothers, and this goes on in most private government hospitals, but not the private hospitals. And you see, if you are in the private facility, you can't travel. Say, no matter the mode of delivery, start breastfeeding within the first 1 hour. In fact, with normal vaginal birth, sometimes at the bed no bed that's so now no be delivered. The baby ne buy ani started amano. We want the colostrum, the first no, the yellow milk. A year vaccine no. Baby ne ano no the bed so no be pulling no. And my pressure at so because at that time no, the hormones are ready to produce. And notice say baby no de na no to so no chia. Bet to me amana bantem. Na et to me abo baby ne home. And so see myself at the recovery unit. It doesn't matter the position. We mostly monitor our mothers in a semi-fowless position at the recovery unit. That's after cesarean section. And with that position, no, just we have a way of positioning them. Until mother no da cry na recover. Baby ne so or the new phone no chenade. Until excuse be anyhow. It is about how you position the baby and obetrin what that cry recover now baby so excuse be any baby we are to breastfeed the first 1 hour and who breastfeeding temonsoa and boy and my milk production no a bantam. All right, because there are so many mothers that complain about breast milk no a delay and maybe they didn't start early.
Oh, okay.
Very good. Maybe they didn't start early. It's baby recovery ward and I why do better delivery ward nana was starting a money phone. Into with that no baby they be now be breathing patch. Excuse me any baby. Oh bet that hona midwife ne fancy some patch. Oh fa me ban man. Oh they oga say area or you see yes some patch. Oh fa me ban man no phone. Me patch what you say. Please do. On farm my crampacho catch and say on farm now within first hour one so person will action.
Okay. Is it possible can say within that first hour the first breast milk is it possible say within that 1 hour no say mamina breastfeed ya ebia no function no abebe and say it changes within the breast? Does something like that happen?
Okay, thank you so much for that. You know, when it comes to the breast milk production, individual difference.
Okay.
Obi waha, you didn't baby ne buy and started in it also. It doesn't necessarily mean say no function be right away.
Okay.
There also o produce crown pono hardly say be leaky out until say pressure kakra beto mana say obe press say actually say eba.
Okay.
All right. Even though we have some pregnant women even in pregnancy produce enough milk. Sometimes we encourage them to store, but ensure that you must say baby need that so no phone so never. It is a your mother who producing well and messing like any waste. Okay. Especially if your baby is not fine, no man for no more than
okay.
At that time you will not get your baby to breastfeed. Into your home mostly we encourage say obey expressing na actually what I say very good. And you see factor so say about say embao funny to no for now. So what the end so bad yeah wherever you are going, especially with the preparation towards birth no, always have your feeding bottle with you. It's ABI you have enough milk and I say Moshe say oh we are starting but we will just help you. The nurses, the midwives will help you express because definitely wherever they've taken their baby, they will ask for breast milk.
Okay.
They will ask for breast milk.
Okay. Oh, can I say about some bow for baby no to na home breastfeeding?
Yeah.
I think I chanced on a video sometime and Omoka say no one explains how painful the first time of breastfeeding is. Is it painful?
Breastfeeding is not supposed to be painful.
Okay.
No. Breastfeeding is not supposed to be painful. That means you need to get the right position.
Okay, so the woman having that pain probably could be because on position.
On position, baby, because on position, baby, we have rules when it comes to breastfeeding. Okay. The first rule is you always need to exercise patience, especially mothers are discharging the coffee, waja baby not to baby needs to, or time nano de nato mufonano without positioning herself well. You always need to be patient enough, make sure you are calm, you remain comfortable, including the baby.
Okay.
Do you get me? Now say so you choose the right position. This year kasa ye ma ye benefona osu bebre na makwa akofana otumi unya akonya obejuju wo ho wo position wo nine well wo pillow bi da wo lap wo fa wo baby na baby no tumi e ma ne lachi well. At the end of the day, wouldn't be painful. And let me say this, in our mouth, okay, after the teeth we have the palates, we have the hard palate and that of the soft palate. Mama used to feeding bottle down. You could see say feeding bottle it's no ever. All right, and you see say who started the mad baby now or to me some ye, and some of the nipples, we have the pointed nipple, we have the flat nipple, we have the inverted nipple, depending on your nipple size. All right, and see imagine say obi or hani any flat and I say a invented one a real mafina ye say your maneuver and sana apa. Such babies almost saw nipple ni mu could see the hard palate neso. All right, and in breastfeeding we don't encourage you say you just give the nipple, and that's what so many women do now. Omakonya this cracked nipple, sore nipple issues now breastfeeding the pain no eban. It is or taking part of the nipple plus the areola, the darker side around the breast now or be taking much of it. You see a could see the soft palate neso. So with that, a shenanuna or chia, and if you know already did it, obiba no nufwa. Oh, baby, do to me no more be janchaya. Oh, or train from Anqua. Oh, yes. Or train from Anqua. And say ye did it. Okay. Say, or to me a hodi, nipple nippers the areola ni year, and say ye did it. But their signs are you say, and baby no or train. Well, can say, or train for me. Patchawati, I say. And you see, the air can say, you see, the air can say, that is not it. That is not it.
Okay. Okay. I hope we are learning. Meeting new things in it. You saw Matia and no crenos so no, and then midwife no ha or she. We'll go on a short break. No answer na ebe compare or answer this question you made. Then whilst we go on a break, please tell others to join in. Uni madam for be our expecting mother. In fact, you shouldn't even wait to get there before you learn these things. Let's spread the information, get people on board to learn from this this evening session. Obi suka se ebia no fo ketuano it produces less milk, no for so and it produces more milk. No cry and I say no cry.
Hello, my ladies. Listen. When it comes to breastfeeding, it doesn't matter the size of your breast. No.
Okay.
It's one of the challenges we mostly face. It doesn't matter the size of. Can you imagine say it doesn't matter the size of your breast. Say a success, so you are going to produce enough. They hear and say after childbirth, ubedidi. Now we're making sure say exclusively or breastfeeding the baby on demand. Let me say this. Those days, I don't know, say maybe in the villages or more was that pipe we were on. Say there's this pipe in the villages at our which now extra now will pump.
Yeah.
All right, that's how the breast milk is made. A hair pressure. So the more now they apply pressure, the more now we to me are producing well, because right from the bone the hormones are ready to produce. Okay. And let me say this again. When it comes to breastfeeding, I'm telling my mothers, beginning no, it is something different for the baby, because inside the womb the like on so no them or swallow no easily, but all by now when introducing breast and breast milk nutrient and so what I say, it's or drink a crowd or better. You will think say one man, and in the early stage, you encourage you say you add breast pump to it. If so, the more you give the breast pressure, the more nana production will be high.
Okay.
And don't see baby nature no or training kakran now so pump in this so. And at the end of the day, you will have enough of the milk. Because we are also encouraging storage, breast milk storage. You to store breast milk just as you store a feed.
Okay.
And breast milk can be stored more than 6 months. NSA.
Wow.
Oh yes. NSA in the refrigerator.
Freezer,
yes,
freezer, intact for the baby.
Intact. That's why you're encouraging exclusive breastfeeding. So whether you are working or not, all you need is your storage bags. All you need, say, ube label. Now I throw the date and the time. You are good to go.
Wow.
It's at the end of the day, you have all these nutrients fully packed, even at 6 months. And when it comes to breastfeeding, it's not about the size of your breast. You are going to produce enough. Eat well, breastfeed on demand when the baby needs it. I wish I can chip this in. Listen, Obi said, my dahwa, or said, oh, my baby need your dough. There 5 hours, cry no, or 1 meal. Can you imagine? Although, go and wake that baby up. Go and wake that baby up. Because a interval with breastfeeding intervals and at the time of breastfeeding, so time also so the first 2 months we are expecting you to feed your baby every 2 to 3 hours.
Okay.
And you know, breast milk is friendly to the tummy, easy to digest. It's even around 30 minutes. If you need 30 minutes time, baby needs to accommodate in the crowd the manner. You are good to go. A bit digest the pepper. It's you know, just say excuse be anyhow. Excuse be anyhow. I will be to me at the amaye. It is that time now with the man no. Now after 3 to 4 months and so, ube breastfeeding every 3 to 4 hours. But no crown because a digestate on demand when the baby needs it. And after 6 months no, 4 to 5 hours ube to me at the amaye. Ube to me the aman. It's the American they say. Excuse be anyhow. Excuse be anyhow. Making sure say obema o baby no for no on demand. And can say order order pan to me your body. Then go and wake the baby. The only answer be stimulating a phone kakra. Obe born in name kakra. Titina son kakra. A shenenu munkwa de obetri. A shenenu munkwa de obetri. Nti odo you. And can say me ba. As you are doing her more harm than good. Because breast milk no. With time no you share say after few months you starting to pay attention to their weight. If the baby is not getting the required amount of breast milk needed, naturally say hard. Not just the weight, you are not giving her the more nutrients and can say a granina or here. You are not giving it. It's Mr. Offici level. Advise yourself. Please advise yourself. Okay, wake the baby up and put the breast in. Alright? Obechi.
Wake the baby up. Man no phone Obechi. And I Antina say the American midwife AKROFI say for who no for size. Near son of crown and produce more milk. Don't worry yourself. What dear man no phone Obechi pressure or baby na apply pressure no now there's more production. Don't worry say me shall see and chair you na no fusio me ma farmer no kakra ebeba. We are going for a quick break. We'll be right back. She has told us the importance of breastfeeding. Mama you say no pursue no hu hia. We say e nyame achede. Enye obi na ye hye ho. Nyame ankasa e na a design body no for no sebe produce milk no. E hu hia especially the first few drops no. E hu hia and you have to breastfeed within the first 1 hour after delivery. So na be a baby ni benya mo friend the gold liquid.
Yeah.
E hu hia palma baby because e kranwa nyoma bi a e be boa ni. No sanso ka che say a vaccination aside ni as a baby ni ye be ko we ni ade e be wo baby no breast milk no e kra ni de so kokora e be boa baby no and now sabo so say e turu bia when there's pain na say baby ni yan position yi no will be na say baby no no more you there you got it all wrong. So we have our special baby with us. She will demonstrate to us and show us how to properly position yourself. Or say position baby ni one kasa tina si na baby na enlarge and then you be church it no no drafa kofi.
Yes.
Sisi ano train senior say kra baby for a first time mother. We so be our breastfeeding but probably not breastfeeding the right way.
Yeah.
And tiene our special guest. We
say
enyan to the D and direct with the program and baby.
Sure.
And ti we do be try and say na say your position in breastfeeding.
Okay. Thank you so much. Auntie, please, before Sabe starting, I want you to know that there are so many breastfeeding positions.
Okay.
So you're talking about a few of them. But the common one that we mostly do is the cradle position. The cradle type position. It is all of you say and as a obane da oswa. Or the fane to hoka krana yen starting. So when it comes to the cradle position, and before you breastfeed your baby, this is very important because you say baby no ebeye infection free. You know, right after childbirth, you are still bleeding. The lochia will still come for some few weeks.
Okay.
It will be because baby needs to know. Okay, in a pad, I want washing inside. No, I bet some baby no they not to know for now. At the end of the day, now we introduce say infections. And so when it comes to breastfeeding, in fact, crying, your baby crying is the last thing I will be checking for. Let me bring this in before I go.
Sure.
Some of the signs that you will see say your baby is hungry. I say baby be or wha. I do obeso mu bia no de or the shena no. E che say the baby is hungry.
Okay.
Say or to wha ana so da wha na obo nanum to. E che say o baby no e commode no nti ko na ko fa no na fa no to no for na no. Your friend be routine say o fa na o twetwe ne kon wa say o hwehwe bibi. E che say e commode no fa no for ne shena no. In fact, crying is the last stage. In fact, I'm trying to my baby no ensu. Say baby ni so na che say koma de na che. Na che say e koma de na che. Until you have to be observant. She will baby no da ho no. Some signs yo what in any so or da ho. E no obo na num toto. E no so bibi o de na nsa. O tam na o hwehwe bibi me pa cho. Fa oba ne to no for na. Inti wakwa wash won say we no Mr. You need a comfortable chair. This chair is very comfortable.
Thank you.
Now making sure say you have pillows. All right? If you say you person we are comfortable, make sure say with the rules. You always need to exercise patience. You always need to be comfortable. Then you choose the right position. Inti pillow no fa ba ku shawachi. E bia na a plastic chair. Fa pillow ba ku shawachi said the beya obenya that support na wa relaxing. And fear that if you're going short no. All right, would it be 2-1 or the 2 would the see one nine say now the 9 so it's a very raisy or 3
okay
abakakra aka pillow ne 1 or the pillow 1 pillow na can or the bed so has at the end of the day a mouth elbow no rest on it now support it. Okay, I'm sorry, but I want to, you know, expose my baby a bit. Okay. Sick of the cradle position. All right. 18 patch off and say, what time I saw be man baby no phone, aqua baby no. And with the cradle position, maybe I shall be a one sayam ni say. Na fashe baby neto. It's baby neto be see one sunny.
Okay.
All right. It is a baby need to know esi won sane yema. Na wo de na ko say. and manning yes say baby no FAC upwards. At the end of the day, no na ya mothers no now what cheering because the baby is far from the breast. And yet tummy to tummy. It is a wofa baby no na nensa no si won sa yema. Na nensa we no we ye a share chwe.
Okay.
It would be who say baby wa ha.
Okay.
Alright? Then the tummy no. Obi beka say, oh, a young black called no ewu ye baby ya me pacho sa de no e wie na dwuma ye wo ye funi. Usom kra hima baby no onsu enye kro. Me pacho what I say. Enye kro inti fa tummy baby ni tummy e betare wo tummy.
Okay.
Ni ti no e be hye wo elbow ni mu say. Inti wo be hu say the head, the shoulders, bibia is in a straight line.
Okay.
Pacha what I say. Say a live baby anka just with this position, ube hu say wa start baby na no because no for no aka no. Ne chin no ebe touch your breast no. All right? And so before you go, obobo na phone kakra e bia onye alert. If is on oni de ekoso. De hia ne sa hye ne num na ochi. Nti obobo na phone no obi na no a. And please don't just point the nipple to the baby. Say or ba benoma hold the areola because enhye da enwa nti no. Oka say u jai ama no ama ne de na no aso ma ne po ne nko ano beji. Nti ube hold the areola ni say.
But your areola in which part?
Black one na is surrounding
darkened
area no.
Okay.
U hold the kakra na wo de ayede wo de ahye. And Mr. With the hand positioning, one sa for ni nyina be hye no for na say. Na tam no adaso. Entwaze ebinom penny say or yes say. Tam no we adwuma or ye. And with this say no for ne so a enko space we mu. But with this it's enough say as I say no for ne to won sem. And yes zipper just one finger penna no for the very rest on. You will not get it right. 84 no for no ni nyina beto won sem na tam no eda so. Imagine say efe na wa wie breast milk no emba papa. It say o position baby no na no for no shena no na tam no emiemia kakra ma.
Okay.
Nti otwe no na onyamo, otwe no na onyamo. Eno obeye fine. Me pa cho say o pe say e bia baby no you can say you always need to empty the breast before you switch to the other. And before no me can say no funsoni man no time that's all. Okay. Say 30 minutes and making sure say 15 minutes. What they need 2 ways so 15 minutes. Or may I now switch it to the other. 1 hour 30 minutes. Or may I now switch it to the other. Oh yes, and nothing I may say as part of the rule as I say we need time. Unya butire. So that obey to me and me because there are so many babies mothers no any time or that no or train just 5 minutes no enjoy at all. 15 minutes time you know there are so many postpartum depression and breastfeeding is one of the cause. As I said we too many time now or train said ye be ya or bet that time as I said with that 2-3 hours no na the time for obey to me under camera and sana wako akoyi ama. And so or train we na say ye breaking suction. We want to break suction. And you say one me and no phone and why ha na what train ye breaking suction. And to win this na finger away. O the share na front and chain. Alright? Now they are pulling the pony out. Because
so you don't pull your
you
breast
don't
out.
pull it and no na a course cracked and saw nipple because say ne hard palate nisi so ebe ma wenya that crack until we break suction what they won sano e share the side no we pulling nipple out. That's how we break suction. Now we switch it to the other. So this is the normal cradle position. Say to me and the right about making sure say no phone is share no oh she say and kata ne hwea na wo beto me ahome. It will be making sure say the hwea is exposed na what to me actually ye. And when it comes to the cross cradle, the here say obe cross one sane keke asa. So this is the cradle position and this is the cross cradle position. Okay. Until we say, you know, bia se utumi enya ne right o ebia wo ya de on person betena ase with say no betumi de nanante no breastfeed and yes chinchira what
also na say.
Then let me take you to the football hold position.
Okay.
We also have the football hold, and this goes to the twin gestation or more babies twins
no okay
it's in patch and train say and yes I will be feed almost almost soon nya ekonya na tena ase. All right, nya konya na tena ase na position omo mmienu ni nyina you are good to go. So when it comes to the football hold, say otamu baby ni say ya fanetiko no eto wonsa ne yemu say.
Okay.
All right, na ne body no emehye omoto omu say pacho wa hu ne sawe ebetumi a baby and Casanca, I say I don't know for this one, but this one will go out a bit. Said the bear will be any. And to say, who kita say, into elbow no, and a support no.
Okay.
Say, baby, normal baby, Esha has say, on to form with that. Say, oh, Tnasia, you will need 2 pillows, back on the Hana arrested or arm for you. And to say, twin back on Shehana back on Sheha. A semnessy. But always be making sure say and yet they ain't katane.
Okay.
And we have the sideline position.
Please, before you go to that, Mami,
sure.
First with the cradle position,
yeah.
Okay, say okay, if you have person breastfeeding 30 minutes,
yeah.
You have 15, yeah. You have 15. Now in this case, me a football position, and I have
football hold.
Football hold.
Yeah.
Now we are twins, and do you have to swap breast and
no, you will not
swap.
2 sides. Maybe you will not swap.
Okay.
I know that you will not swap. All you have to do is to express when they are full. So you will be able to top up. But with the twins that you are not supposed to, switch the positions.
Let me add another one. Now we are tripleting swing.
I know they are back on triangles. Easy. Back on triangles.
No, won't that baby lack? Because first 30 minutes no accord to the first 2 no. Then the third baby no say sorry to say or no enough.
But the kind I can say the more you put pressure on the breast, the more the production increase.
Okay.
And see trainer or trainer na hormones no effective no more producing milk no. And see breast milk in some just that in the early stage you know it takes time. Ebi de eche obi de wo ho be a whole week na onya ya mesro onya abotre ebeba but making sure say unja baby into baby fa formula a always be a faneto so pressure na o put no be manaba and I say get the breast pump na fa pressure to so ebeba
into obi a ne breast smoking back for the first week you know I know there she's allowed to add
oh yes she's allowed and please listen. Say ABR first day, second day, third day, fourth day, or breast milk and buyer, we can still go in and give the formula. But that is if you are at the hospital, the doctors will prescribe.
Okay.
Because sometimes there are other different things that they might recommend. But if there's a need to go for formula, they will prescribe it for you to go for the baby. And giving formula doesn't mean you are not exclusively breastfeeding. No funny buy pack a formula to baby. In fact, fache now continue with the breastfeeding. You are good to go.
Okay. It means to me for me pet because if you are discharging me coffee and a mano means me so you got to formula and bring
and no na is your moon because formula products no a boost of pharmacies into be a man and musana or no funny papa but or say a main baby or say emba into your quacoto. Instead of say, Obema baby, enya all the benefits needed in this nature's milk, no, or see baby, Obema I mix feeding, and mixed feeding comes with a whole lot of issues, Into me patch all. You see rule number 1: be patient.
Okay.
Now, but trainer making sure say, Obena time if I were to see her, etnase, na funny to no phone. And pen tempo baby. That's why after childbirth we recommend say we support persons, someone that will be there obey you because say we busy and I say oh and by many time I may find it to come baby. But say oh time tena say nanya time na on that so.
In fact, and that's what time was say we make it time no for your baby.
Just say time in so yeah that 2-3 hours no funny to so. Funny to so there's no excuse. Aka one position.
Sure, let's go ahead.
And then one position is the sideline position. And that one you need to be in bed. And this is recommended for mothers maybe right from 3 months going. But of course right after childbirth, cesarean section mothers say yes side one or Emma. Into any day be na this out na say a cradle position. No. It's all the be your football hold na fa sorry and nancy. Se baby shehana or breastfeed ya. Utume ya dear uye bia. Not necessarily say obetina say any time. No. Se be ya always be ano in one position. And until with the sideline say odaho na baby is swan. And you know say hand washing no and share down near that frequent. Always get sanitizer with you. And I don't know what sorry no also I will sanitize here. Now I'm making sure say open face towel and have face towel with you. What for now they are paper no phone and son out their man. Because brand new infections all over. Alright, now with their man. And it's a wood the netto cider. Now so what Daniel was cider supporting with pillow. So the bear on faso. Okay, and see all the pillow need to nechia or bear one is side. Now so that was side. Now what position? Always be making sure sending raining kataye because with that position, obey to me craft for mother.
Yeah.
Obey to me for mother. It is a to me position and raining you okay. Allow the baby to feed. Obey that cry, obey you okay.
Okay.
That is, these are the common breastfeeding positions. Those of us that midnight sleep, no, and yes, about baby never wonder because baby will wake you up more than 10 times before at the bedtime. Mr. Try to change the positions, especially with the left side. Okay, position ye na you or benom nadi, and let's remember this. And for baby and to no fun na emfa name to her without patting their back to bed. Me patch baby e feed we are. Se oka say oh as I say yin from because whether what position well or not, still now obe swallow in farmer okay. And see with the burping position, to make the network was stress or obosu say tummy position. To me the unsana fanachi or obemane light one. And please let me demonstrate this. Yenye ni say ufo di woham ni say nti tap air. Okay. Alright. So with this to me abe fine. You are good to go. To me the now bow shoulder. Now I okay. To me the natural sasu say. Now I Nina obeying from Obi say, me bani de me bonne chia on baby o.
Come on, baby, say na want to hear one.
In fact, babies be about the eche. Obi wo ha ni de cry emba cry me pacho. Wo de nya wo time. Say 10 minutes farmer no na fabo bonechi, say 5 minutes farmer no na fabo bonechi. But there's one thing. Say baby ni yin farmer o baby anasa one baby ya. Mr. Men fanning control flat say. If you say aspiration, easy for them to aspirate. And you know, I had to say, open you want to trial. Wow, you can imagine what will happen to the baby.
Also to me, because I say baby
no, baby be all to me, but who say some babies will aspirate to death. It's very dangerous. Especially and I don't know and nana ba when so. Say left side there, or we not than the left side or you okay. Say or say or bepe and I say or fimpa a better side have no epi. But a cradle position where we now the nakoto flat, that's not good.
So okay. How do we position our babies after feeding?
After feeding, fanet on the side, any of the side.
Left or right?
Left or right, not supported with pillow. It is a oka say or fear, a be funny happy. But say what the netu chair. Ebekwa could choke him now aspirating. There's one time that there's this lady that may sure say aspiration and Charlie, it wasn't easy. Okoche wo niku. Okoche wo niku ntime pamucho. Yenkai we. Baby need the DVP. Fan it on the side, not supporting with pillow. Tell the bear on and so. At the end of the day, you are good to go. Not assemble then assemble.
Okay. What of line?
It's not advisable. It's not advisable at their age. With on that on the side, no.
Okay.
That position from 5-6 months now, I started tummy time, no. Yes, to me, yes, sir. Because by then, no, they are in control of their head. You know, all the little left a bit to me other or break a bit to me at 20 to the other side. But we all the little flatter. Now say or mistake or better say at the end of the day now or film and also any factor. So that is the types of breastfeeding positions. Say you try any of them a bit to me and why now you want rather than always going for the cradle position. And no one anymore challenge. But there are so many ones that will help us.
All right. I think you also mentioned about the exclusive breastfeeding.
Yeah.
Now, Cecilia, you say we working mothers.
Yeah.
They're very then 6 months. Even 3 months, also go back to Juma.
Yeah.
Even after 6 months, the class, so the baby breastfeeds. How do we handle it? You mentioned you're able to preserve the breast milk.
Yeah.
Tipacho, can you walk us through that?
Sure. So to my breastfeeding mothers, you are going to do exclusive. Excuse me anymore. In fact, kasobe to me to me because you know that nutrient no name ahodine wo breast milk ni mu no obaninya ekosi that 6 months now when we otwanu for no after 1 year crampo na that baby is going to be perfect. All right, all the benefits needed, no baby will be able to have it all. And what is so we juma so we juma fashion with you so be then ube to me and into answer midwife many the same into the American say baby nina better make sure say our breast pump say sample there we have the bra type breast pumper.
Okay.
Say a shema uwe juma kra na shemu na express.
Okay.
And I say the electric one or the manual one 3 months time or so o kwa juma make sure say ube fifi no one my baby na breastfeeding am me. All right, me ba chofa pump no edi wechi eko yema breaker a manual or electric kope baby shena express already no why express be a fridge leader. It's what in it na make I say right after birth no hormones no are ready because first 2-3 months no breast milk ne sote. But those that starts early almost starting in term the pressure so no cry and baby. I know so many mothers are after 2 months 3 months on to make just a drop of milk. Why? Or my baby ne quite depending on it. Medical culture say baby ne pressure no something little. And this is who are the breast pump and at the end of the day putting in much pressure. A bema hormones not actively or much to me they are producing. Okay. And not to when you set time best or time baby resuming work, you know what starts here pumping. Get the storage packs a doorstone. And with the storage packs all you need to do is say and leaky and I say spy or express here now about any data to home. Now what the time now I express now then I can now I store our freezer. So freezer for 6 months in the refrigerator for 4 days and no crown of a bang a cherry honey to me ice crown or the chef free door now bibian can. All right, room temperature 4 hours.
After 4 hours, the baby now feed you have to discard.
You have to discard it.
Okay.
At China 6 hours, you have to discard it. You say, I also would need fridge cry, auto ice cube, not the top a flax man.
Okay.
And no, just for roughly 12 hours. 12 hours.
A bit to me and hold.
A bit to me and hold it. It's in patch of 1 man and may na what Jano ever Jimemon. already no ade beche no obekọ adwuma, you have enough in the fridge. And see first one say and then I will start it. No, maybe you started expressing 3 days ago.
Okay.
And 3 days ago, date no was 31st of July. You have up to today's date, which is on the 2nd. And it will be 31st there no. Do you get it?
Yes, I was a target.
As a cell label no.
Okay.
With the date and time. And it's a baby no accommodate na may 2nd there no emfa emma no. We best starting no earlier no, right? It will be here fi freezer ne mu e dey abeto refrigerator. Ade beche na ye den a melting. Yeah, microwave breast milk.
Some come baby sir.
Yeah, microwave breast milk. You need warm water. Now would you sim? It's a also. Some of the storage pack we have calibrations on. A bit to me find maybe 150, 200 mils, 250. And where you now would get to honor the chair asano. Catch a grandma now whoever will be taking care of the baby. Now catch and say baby accommodate the bima. Or the feeding bottle on the bay. Obe measure 50 mils. And I said by then, no, after 3 months, over to me cry at the bay 100 mils, 120 mils, 150 mils. It's on share and good feeding bottle on him. Now on fat insure, on fat and sin so sharing. And this is how we test for breast milk, the temperature. This is how we test for the temperature. Right from the breast, the temperature is cool. But the go. Or the too warm water you need to test for the temperature. It will sprinkle or be a good skin. A too hot or be a too warm or be. That's how we test for the temperature of the breast milk. So please instruct grandma or auntie or daddy or whoever will take care of the baby. Time this one or be continue. And see what do a jumemu hono or break time no. Say oh the shebra ni munedia. And ya wuye jumeni in an woman, oh, yeah, Jumana, na pumping. But to break our now, I baby, I should now want ye cry until we fear banner. And I'm sure most of our workplaces we have fridges in there. Now the actual natural say it to me abo to say oh baby back. Into waitress you have no excuse.
No excuse.
You have no excuse at all. Thank you so much.
Thank you, Auntie Ness. Hey, why do I accuse? I'll send me money. Maybe one for AKROFI. Thank you so much. Where mommy who said no crevice started me catch say and yet for mothers, expectants mothers. Because if you are not say working mothers say you be a baby will fear a mother. Sometimes you be a baby a mom a daddy. Also koya de kakra. The men have to learn these things to also know how to care because the baby is for both man and woman. And your mom in a baby. Yeah, said here.
Yeah, right.
That's a power on that part. Your question back or say, please, can HIV positive patients breastfeed?
Thank you so much for this question. HIV positive patients. It's a yes and it's a no.
Hey,
you can and you cannot. If you are HIV positive mother, please listen. You either choose formula feed or breast milk. Nothing more, nothing less. You are not to mix them.
How so?
We don't mix feed. To say obi a only HIV conditioner, oh baby ne ye kakra, ye can ye say my name for formula, but oh me shower me oh dear my man formula kakra. Oh no, that baby is okay. But if you are HIV positive mother, you either choose breastfeeding only without adding formula. Nothing more, nothing less. So now to me breastfeeding throughout me patcho then go for formula
straight away. Men
mixing feed. Other mothers cannot. It is not supposed to be so because already no your baby no or that HIV medication so. All right. Until we introduce the formula plus that of the breast milk, you know, we are getting enough nutrients in there. We are getting enough antibodies in there, a protected baby, but that can never be compared to the formula. Until at the end of the day, I say, of course, say distractions be in there because we need the breastfeeding now. Exclusive. We need that natural antibodies to help out. So the vaccine na yedi baby na to so no ebe tumi aye adwuma pepepe
Into HIV mother betumi amani
obetumi amani banu for 24/7.
Wow.
But exclusive.
Okay.
Exclusive. Oh yeah, yes 6 months na mai we na wunye bi nkra. We are okay.
Okay. Now they're also switching to
formula there was saying. Okay. And you know one thing about the formula that SSA is sharing so they say that nutrients can never be compared to that of the breast milk. Never.
Yeah, you said so.
Never. And ABR also nan one was nan one. And because it need those antibodies that fight infections and allergies and so on, onyama ne kakra na fe was starting enya allergies, ABR bibia betuto ne ho, ABR ofefefefe, ABR orane. Pacha what I say.
Yeah.
Now we jai oh nanwa no enso engeno. ABR will fire and just a little and then starting man with this reaction. No akope SMA. Oh, when they better know now all them who are full of different formulas. And it's expensive. It's expensive. And you know, unlike breast milk, baby needs to or adjusted the comfortable position. Now why are they what position baby no always available? It's not like that of the formula. Formula already necessary do seek a formula no. As I said, we need sterilizer and I say always be our hot water or best sterilize the feeding bottles no. And you're very necessary. And you just don't fetch formula to mix. We measure. We measure the water, we measure that of the formula as well. And you always need to get the right temperature and sun out to media and you manage those. So which one would you choose?
Oh, Charlie, I'm going for
breast milk.
Breast milk all the way.
It's always available, ready for your baby. And you may be any home. Won't you one city? The answer or the chair and then be now pay. Please choose rice. So HIV patients you can breastfeed, but you need to choose between formula and breast milk.
Thank you so much. I wish we could
you
go
so
on
much.
and on and
Yes,
on and on by
Charlie.
a time, no. And to Deborah, I believe you've been answered rightly. If you have any other question, you can put in the chat as we wrap up. So let me just acknowledge those who are on the call. We have Deborah Ahin. I'll say he's God. He can do all things. So China, I'll say hi, midwife AKROFI.
Hello.
And then Pastor Gumbiade also say he is God. Irama is also with us and also say he is God. And as I said, my journey, let's continue to share. Though we are wrapping up, you can still share the link with others for them to join in. They can listen afterwards and learn a lot from this. If I have learned a lot today, and I'm going to share it into me. No crime. I can just say no. Stop right there. And yes, son, I'm midwife AKROFI. Sisi ame so me kwachire say minim. Sisi ame nimpa. And as we wrap up, I mean, can you give us 3 key things to take away with concerning breastfeeding?
All right. Thank you so much. And I'll go with the theme for today. Every drop counts. Breastfeed with confidence. Other you. Ma when just say breastfeeding. Ma when just say you are giving the best gift to your baby.
Yeah.
Ma when all right? If you say this is the best thing you can ever do for your child, and feel proud, all right? Because you are doing perfectly fine. There's one thing. Our daddies and our aunties and whoever is there, they are supposed to help us. When it comes to postpartum depression, it was stages after childbirth. We run from postpartum blues, then the postpartum anxiety, then the depression comes in. Study says after childbirth, postpartum depression is much higher than in pregnancy, especially if mothers are not getting help. It's impartial. So we will fear daddy. Maybe I make say, our mommies, daytime, me express here, daddy, and I don't know, baby sorry, on famano. So the baby will be to me enough breast. And if you are a daddy or if you are a husband or an aunties in there to take care of a child, make sure say open monitor the lady breastfeeding, your wife. Yeah, and Sisanya Binum Ewogona Woshena and Koya. One Kasafa Nebra Hospital. And Sanaya could do that anxiety level. Or tell Osrika cry, now was son now was sorry. Who said, no, there's not my wife. You should be able to detect that. But what I'm saying this means that breast milk is the best food you can ever give your baby. So person will banana dream or yes shark. All the developmental milestone no person will baby no achieve in a year. Me patch will give the baby the breast milk. And you know, where with the mother, baby no air benefits, na yen so yeah benefit. If you want your uterus to contract, if you want to burn off calories, if you want to avoid postpartum bleeding. In fact, if you come to breast cancer and ovarian cancer, exclusively breastfeeding your baby, you are not at risk of. Your risk of having it is very low. In fact, so dear baby, ma yemano any yankasa, and please choose right. When it comes to breastfeeding, we can't choose for you. We would just educate you for you to make informed choice. Choose breast milk and you will just love it. Let me recommend my socials to you.
Okay.
On TikTok, Midwife AKROFI. On Facebook, Mary AKROFI. IG, Midwife AKROFI. It's all about maternal health, anything pregnancy, anything childbirth, postnatal, anything concerning women. We are there to help you. I have a pregnancy school that I have. It's a safe community for a lot of pregnant women. Every blessed day will be and I'll always be available to call out for. And I just cry out to be friendly and we interact a lot. It is how now say pay midwife to me and then communicating to me I'm always available. My pregnancy school, I recommend it to you and I'll always be at your service. Thank you so much.
Thank you, Midwife AKROFI. Like I said, I wish you could go on and on and on.
Yes,
we're just wrapping up with last tips for us.
Yeah.
But I have some questions coming, so let me just take a few minutes for these to be addressed before we go.
Okay.
Okay, so there's a question that says from Deborah, say, please, is breastfeeding recommended with mothers suffering from breast engorgement?
All right, thank you so much. Breast engorgement, cracked nipple, small breasts, I'm not having enough. These are the minor challenges that we keep hearing. And with breast engorgement, please listen. Please listen to me. You always need to breastfeed your baby. With breast engorgement, always breastfeed your baby on demand when your baby needs it. Anytime your baby needs it, please breastfeed your baby. Obi wa wa kwehye mu saa na ne nufu na hyehyɛ. Oba nso a ɔmfa ma. I don't think I said time that's all. If it is 15 minutes, make sure this one is empty before you switch to the other. Now making sure say baby not empty. Me pacho wada stimulating ne chick. Okay, titi na so ho kakra. Obe continue na wano no phone. Okay. Sometimes you are empty no phone at the end of the day. Na bakwa akoye kese eja bako. And when the breast is engorged, please breastfeed or express as well. And yes sir, it to me yes sir na infection setting in. So you always need to let it out. Say baby ni so na ya wo ya fa breast pump no eto so na into me AMT and na into me AMT. And please say a year we are bebre obunya ice block what the total woman now they are to sokakwa ebe we live from the discomfort and I say I hear the ding bebre so I wunya hot water now squeezing excess water no from the towel what the to so and also Emma a relieve kakra from hardness na iron me pacho breast engorgement make me ama wuti ayo ya. In fact breast engorgement make me ama wasanya back to admission. Oh yes, because you will start having fever. And to say you sign either with to a draw so as bad time. And it's please. And in our local remedies, we are also saying say unya cabbage I blog out there or their chef fridge mama na blog. Oh why say cabbage at trebisan. So why now the told it's just like using the ice cube with the chef brand now with the nama and also a boy I relieve you.
Oh, okay.
So and confirm bibia and fifa so all you need to do is say will say your breast is full, empty it,
breastfeed
empty it, so express and allow the baby to suck. Okay. You are good to go.
Okay, the last one before we go. Say, this from Patience Ajay. I'll say, are there some foods that breastfeeding mothers have to eat to increase breast milk?
Oh yes, there is. There are so many things you can do to.
Can you touch on a few?
Oh yes. And a few things that I would like to talk about. You know, these days we have so many breastfeeding teas available. I'll be to me, I get one. Please, when it comes to the teas, I will recommend fenugreek tea. Fenugreek is very effective. Obetumi and the seed no or that of the powder. Or no as tea is very effective. Moringa tea is also there.
Okay.
Then flax seed is also there. We also have taking in enough soups. Enkwan no endorso. Enkwan bia light soup. Abenkwan. You know, back in the days, now omo abenkwan abedro. Just for very good abedro. Palm nut soup, but specifically for mothers or my worry. Enkwan keke ne bi omo the body back one too. Enkwan no ne pesa unum bebre. The more now one no. And ice cake. Say a C-section na o pese wound no e wound tema. The first few weeks ne dey men fa milk and too, but fat granules. We hear granules bebre. Nti say fancy cake no with granules. Normal granules ne cry when a bottle no as a worry and also it's to me more of the fruits because all breastfeeding no na a relieve uterus need to contract until you need more fruits, that vitamins and minerals no ashemuma. Don't forget say after childbirth you will also take your vitamins and no semunya. So all these and many more, your fruits and your vegetables finding in our bubu na di na no ebeboa manifun so na ba.
That's a P made my AKROFI. Some I'm sure ya and then you better hire that's a papa say and then you've made time to join us on the health talk show and she's really educated us a lot. Personally, I've really learned a lot today. So I'm a kind because you see it's a CRD no information pa maybe so I believe say you also learned a lot so what's it near writer you quickly in the nice way and you talk nice way no correcting say oh and to say we say now say a go beyond what the mother can do yes your hospitals they are always there to assist us. Go to the hospital and get assistance as needed. Yeah, but breast engorgement, no, so I've not really heard about that. But waboso, if there are any other conditions, who feel say, why be actually say, oh, yes, so and far, Mr. Infant Nefi, Bomodia Fako. You can so near you and Mamote, yen chain, what we are going through. So, ocean now banning yam one, patch of one, which man chain cry. Yam wow, if we say breastfeeding, a age market, better give feeding bottle, date and time, and age market one. And see, ye deny yen soon, nayam wana, yema, I won't from Omunya the right time, enough breastfeeding, even more we need to get the right nutrients when we need to grow well and then we will all have a healthy family, a healthy community. So thank you once again for joining me on the Health Talk Show. My name is Abigail Kwe and today's discussion has been on breastfeeding, focusing on the thing that every drop counts. Mothers, make sure you breastfeed with confidence. It's been a pleasure hosting you and we'll see you same time next week, 4 p.m. sharp with another exciting episode on the Health Talk Show. See you. Bye.